how can you eliminate the titanium housings from, becoming loose or needing to be rebonded?
Yeah, that's a real issue. We take all the precautions when we're doing all on fours. We sandblast. We use a product from Bisco called Z Prime Plus to prime and prepare the surfaces, and we follow all the bonding processes. But the fact of the matter is, if those all on fours have been in the mouth for a period of time, sometimes they can torque loose just from the movement in the mouth. They torque loose, and so on occasion, the clinicians having to rebond those back in, or they send it to the laboratory to do it. And one way to eliminate that whole factor is, again, with a titanium bar. The titanium bar is the advent of 5-axis milling that's in the business now, and some of the higher end milling systems. We're able to mill these bars that will precision fit inside of the zirconia to add that extra strength. Well, of course, we use it for strength on a regular basis, but it eliminates the housings popping out because you don't have any housings any longer. So you kind of accomplish two things at once. I don't know what percentage the housings come out. We just see it. I know that we see it, every few months or so, one will come back in that some of the housings, they've been in there for 2 years or something like that, and the housings work loose. So we know also that the titanium bar is an extra expense. But that is one way to eliminate the possibility of that happening, and kind of kills two birds with one stone. You can take care of the strength issue if you have it, and you'll never see that housing come back that's been delaminated. So that's one way we would do it.
And listen, there might be a little bit more expense, but if I'm replacing my teeth as a patient, I want the longest lasting, absolute best option. And most of the people who call me when they're looking to, attract more implant patients and things of this nature, I'm always teaching them, you're either marketing to people who are looking for the cheapest, or you're marketing to people who are looking for the best. Yeah. Don't you dare market yourself as the best and then provide the cheapest. You need to have brand consistency here. So
I think along with that, I think that one thing that the clinicians can consider, and it's kind of the clients that we attract just by the nature of the beast, is they're interested in the reputation. They have a geographic area that they do business in, and the reputation is paramount in that area. But oftentimes they'll send their posteriors to a less expensive lab, and their anteriors, which is what we specialize in, to a little bit more expensive lab. But my opinion's always been that when they go home and they had a bad experience with a posterior, they're going to complain just as much about it as if they had a bad experience with an anterior. So are they really saving a few bucks when you consider the reputation on that posterior? Of course, we like to do posteriors, and we like to do more of them, but that is a trend that we see, that posteriors are sometimes sent to labs that are offshore or less expensive labs, and I don't think that it does a justice to them if they're trying to improve their reputation and maintain the reputation in their area. So.
No, certainly not. And I do see this a lot in marketing, that we use the best materials, the most, don't just say it. You have to live your brand.